How familiar are you with the world of cancer statistics? It might seem daunting at first, but understanding these numbers can provide invaluable insights into the fight against this disease. Today we're going to dive into some key terms used in cancer statistics and how they're calculated. Firstly, there's the Crude Incidence Rate, or CIR. This term refers to the number of new cancer cases per 100,000 population, without any adjustment for age. It's calculated by dividing the total number of cases by the total population and then multiplying by 100,000. The Age-Specific Incidence Rate, or ASIR. This is the number of cancer cases per 100,000 population within a specific age group. Is the Age-Adjusted Rate, or AAR. This is the weighted average of the ASIR using the world standard population. It allows for comparisons between populations with different age structures.
Prevalence helps us understand the burden of cancer at a specific time. Point prevalence refers to the number of cancer cases at a particular moment, while period prevalence indicates cases during a set time frame. Both offer invaluable insights into our current cancer burden.
Cumulative risk is another important term. It's the probability that an individual between ages 0 and 74 will be diagnosed with cancer in the absence of any competing cause of death, assuming current trends prevail. The annual percent change, or APC, represents the annual rate of change in cancer incidence rate over time. This is used to generate time trends in cancer incidence rate. Then we have the overall survival, or OS. This is the probability of surviving for a specified period after a cancer diagnosis. This is estimated using the actuarial survival approach. Relative survival is the OS in the cancer patient group divided by the expected survival of a comparable group from the general population, adjusted for age, sex, and year. Median disease-free survival is the time at which 50% of patients remain free of disease after treatment. Lastly, the 5-year disease-free survival, or DFS, is the percentage of individuals free from disease recurrence or progression 5 years after treatment.
Next, we'll look at mortality rates. Mortality rates give us insight into the deadliness of cancer in a population. Age-Standardized Mortality Rate, or ASMR, adjusts for age differences, while Crude Mortality Rate shows cancer deaths per population unit without age adjustment. With the mortality rates clear, let's move on to survival analysis. Survival analysis helps us understand the prognosis of cancer patients. Overall survival, or OS, is the time from diagnosis to death, from any cause. Relative survival compares patient survival to that of a cancer-free population. Next,
Age-Standardized Relative Survival, or ASRS, is adjusted for age distributions using the NCRP data. The 5-year overall survival, or OS, is the percentage of individuals alive 5 years after a cancer diagnosis.
Explore the use of tumor registry data. Tumor registry data provides us with valuable data on cancer cases. Population-based cancer registries play a vital role here, collecting data on cancer within a defined population. This gathered information is instrumental in calculating incidence rates. Now let's move on to the concept of attributable fraction. Attributable fraction helps us understand the contribution of specific risk factors to cancer. Population attributable fraction, or PAF, estimates the proportion of cancer cases that can be traced back to a certain risk factor. Next, risk assessment helps us understand the risk of developing cancer. It involves calculations of relative risk, comparing cancer risks between exposed and unexposed individuals, and attributable risk, estimating the proportion of cases linked to specific exposures. Next, we'll look at spatial analysis. Spatial analysis helps us understand the geographical distribution of cancer cases. Geographic Information Systems, or GIS, play a pivotal role in this. They analyze spatial distribution, helping identify clusters or patterns of cancer cases. Finally, let's discuss descriptive epidemiology. Descriptive epidemiology provides us with a comprehensive picture of cancer distribution. It examines various characteristics like age, sex, ethnicity, and socioeconomic status, painting a detailed portrait of how cancer cases are dispersed within a population. Understanding these statistical methods gives us a comprehensive understanding of the cancer burden in a population. In conclusion, we've explored various statistical methods from incidence and prevalence rates, mortality and survival analysis, to tumor registry data, attributable fraction, risk assessment, spatial analysis, and descriptive epidemiology.
In summary, understanding these terms and calculations can help provide a clearer picture of the current state of cancer incidence and survival. It's a complex world, but with knowledge comes power. The power to understand, to compare, to analyze, and ultimately to fight against cancer.